it appears we have a new subtype of triple-negative breast cancer in the metastatic setting, the PD-L1 positive population. We're going to need to identify those patients reliably. And so this becomes a pathology challenge because the PD-L1 can be ascertained on the tumor cells themselves, on the immune infiltrating cells, or both. And the Impassion 130 looks specifically at the immune infiltrating cells for PD-L1 positivity, but other checkpoint inhibitors have developed PD-L1 positivity on the tumor cells or on the immune infiltrating cells, or a composite score of both. And this will be a challenge for us oncologists to request PD-L1 staining that was done in the clinical trials that proved the effectiveness of these agents, and for pathologists to utilize the right anti-PD-L1 antibodies depending on the agent that's in question, and to read and interpret the PD-L1 positivity based on tumor cells, immune cells, or both. I think that's going to be the easiest, is to read out both, and then the oncologist can utilize the information as was done in the clinical trials that led to approval of the checkpoint inhibitor. So there are challenges ahead, but fortunately this has been going on now in 10 or 12 other cancers for quite a number of years, so we'll be able to learn a lot from our colleagues. The nab-paclitaxel atezolizumab is a very exciting advance, and I'm sure it'll become the standard of care for the PD-L1 positive population. And then the question is, where do we go from here? So we await the results of data with gemcitabine carboplatin plus checkpoint inhibitor, in this case pembrolizumab, to see whether getting a DNA damaging agent such as carboplatin together with a checkpoint inhibitor will make yet another advance. And then, of course, targeted therapies, interrupting key driving pathways in triple-negative breast cancer that may make the cells refractory to checkpoint inhibitors, such as interrupting the AKT pathway, combining ipatasertib with atezolizumab and nab-paclitaxel, for example, a very important and exciting triplet that's being evaluated. Another example of great interest to me, being done at the University of Kansas by Dr. Priyanka Sharma, combines the HDAC inhibitor romidepsin with nivolumab along with cisplatin to try to increase the immunogenicity of these cancers, bring in the DNA damaging agent along with the checkpoint inhibitor in metastatic triple-negative breast cancer. And then very importantly is getting into the curative setting, getting into that preoperative setting. And we await the results of the first trial, Keynote 522, combining preoperative chemotherapy with pembrolizumab in the curative setting to see if the pathologic complete response rates will be higher and disease-free survival improve. So incredibly important.